I'm with Dr. Denice Cora-Bramble, Acting Executive Vice President at the Children's National Hospital, Washington, D.C. Hello.
Good morning.
What are you presenting this year at the World Healthcare Congress Middle East?
I will be a part of a panel. We will be talking about healthy lifestyles. My specific section focuses on the role of schools as it relates to improving healthy lifestyles in children and adolescents.
Why is an event like this important?
Well, I think it's important not only because of the networking opportunities, but it also allows people from different countries to hear about best practices. I think we have a lot to learn from each other. Some of our challenges, even though we may be halfway around the globe, are very similar. And it's a great opportunity, a great forum for us to learn from each other.
Mm-hmm. What are some of the challenges your organization is facing in healthcare?
Well, I think for us, one of the things that we have a challenge that we focus on. It has to do with improving the health of our communities. So we provide services to an underserved population, and our goal is to make sure that the services that we provide actually improve health outcomes in that population. So you've heard of the phrase child health disparities. Well, we focus on eliminating and reducing some of those disparities in children.
Mm-hmm. What are some of the innovations your organization brings to healthcare?
Well, one of the things that I think is unique about the work that we do is that we have an integrated primary care system where our different models are completely integrated. So we have health centers throughout the District of Columbia where we have centers in physician manpower shortage areas, and we also have regional primary care physician practices. So we're able to, through networking, through information technology integration, we're really able to focus on the care of that population in the District of Columbia and in the surrounding region.
Do you find it difficult to get communities, and especially different parts of the world, to change their lifestyle? It has a lot to do with culture, tradition.
It does, and I think that's been one of the things that's been really fascinating for me is the impact of culture when we try and improve and to teach children and families in terms of healthy lifestyles. You have to consider the cultural environment and what norms would be appropriate in terms of us teaching families what to do, how to cook, what to cook, how much exercise. You have to consider many factors in addressing those issues.
So not just reaching out to these children in school, it's also giving this information to their parents.
Absolutely.
In a way where it's practical and adaptable.
Absolutely. You really cannot talk about implementing practices unless you involve the whole family unit. So when we're telling children about what to eat, it's really the parents or the hired staff that are involved in preparing those foods. So you have to make sure that they're included.
Is there a role for the government or regulating bodies or schools in general in submitting that information?
Absolutely, and one of the things that I think one of the beauties of the work that we do is being able to include the schools actually as a partner as it relates to improving health outcomes in children and adolescents.
What do you hope to learn or teach at the conference?
Actually, even in attending the session this morning, it was instructive to hear how people from around the world are tackling some very similar problems, how we relate to issues and apply, for instance, technology in terms of improving the work that we do. So to me, it's been a really fascinating experience.
Dr. Denice, it was lovely talking to you.
My pleasure.
We hope you enjoy the rest of the conference.
Absolutely.
Thank you very much.